true story from the world of medicine. It's not a story about a single, obvious mistake. It's about a sequence of decisions that, at the time, seemed perfectly reasonable. And that's what makes it so terrifying and so important for all of us to understand. Let's set the scene. The hospital was modern, well-equipped, and highly respected. It was a place where rules were followed, where experience was valued, and where serious errors were thought to be almost impossible. The doctor at the center of this story had built his entire career within this kind of system. He had years of practice, had treated countless patients, and had a solid reputation for his calm judgment and confidence. He wasn't reckless or careless. He was experienced. The patient arrived with a complaint of persistent pain. It wasn't sudden or extreme, but it was constant enough to be worrying. The initial checkup went exactly by the book. Vital signs were taken. Basic tests were ordered, and nothing immediately screamed emergency. On the surface, everything looked stable. But medicine is rarely that simple. It almost never reveals the whole picture at once. As the hours ticked by, small, subtle changes started to appear. A slight variation in the heart rate, a minor shift in blood pressure, lab results that didn't quite fit the expected pattern. On their own, any one of these small details could be easily dismissed as insignificant. But taken together, they formed a quiet, insistent signal that something was wrong. The nursing staff noticed first. Nurses are trained to observe patients over long periods, to recognize when the rhythm of a person's health just feels off. Even if they can't put a name to it yet, they documented these changes meticulously. They followed protocol. They communicated their observations up the chain of command. Meanwhile, the patient continued to advocate for themselves. They reported that the pain was getting worse, that the discomfort was spreading. What had started as manageable was becoming hard to ignore. The doctor reviewed all the new information. He compared the patient's data to his vast library of past cases, to the hundreds of similar situations he had seen before. In his experience, presentations like this often resolve on their own, without needing aggressive intervention. You see, a huge part of medicine is pattern recognition. Experience teaches doctors what usually happens, but the word usually is not the same as always. Based on his clinical judgment, the doctor made a decision: continue to monitor the patient. No immediate escalation of care, no emergency procedures. This wasn't a snap judgment. It was deliberate. It was measured, and at that specific moment, it made sense to him. The hospital environment stayed calm. The daily routine continued. Staff moved from room to room, from patient to patient. Time passed, but inside the patient's body, a crisis was quietly brewing. The subtle signs started to get louder. The vital signs began to fluctuate more erratically. The lab values drifted further and further from the normal range. What had once been quiet inconsistencies were now becoming clear, undeniable warnings. Still, nothing dramatic happened all at once. This is how so many medical disasters unfold. They aren't sudden explosions. They are slow-moving fires. And by the time the situation finally escalated, it did so with terrifying speed. The patient's condition suddenly deteriorated. Alarms blared. The medical team rushed to respond, activating emergency protocols. But the decisions that once had a window of hours now had to be made in seconds. Despite the rapid intervention, the delay had already caused irreversible damage. Critical time had been lost. In the aftermath, the hospital launched a full internal investigation. Every step was retraced. Every note was examined. Every decision was reconstructed in sequence. The goal wasn't to assign blame or punish anyone. The goal was to understand how this could have happened. And what they found wasn't a case of negligence in the way we usually think of it. The warning signs had been there. They had been documented by the nurses. They had been communicated to the doctor, but they had not been acted upon with the urgency they required. The investigation revealed a fundamental challenge in medicine. Experience is priceless, but it can also create dangerous blind spots. When doctors rely too heavily on the patterns they're used to seeing, they can underestimate the possibility of a rare or unusual outcome. Subtle signs get rationalized away. Early warnings are minimized. As a direct result of this case, the hospital's protocols were completely revised. A greater emphasis was placed on looking at the cumulative effect of warning signs. New guidelines were created to encourage earlier escalation whenever multiple minor abnormalities appeared at the same time. Training programs were updated to specifically address the cognitive biases that can affect a doctor's clinical decision-making. This case became a cornerstone of medical ethics discussions, not because of a single, glaring error, but because it shows how easily a chain of reasonable, well-intentioned decisions can lead to a catastrophic outcome. In medicine, harm is rarely caused by one bad choice in one moment. It's often the result of delayed action, of waiting too long. Those small warning signs matter, not because they always signal a disaster is coming, but because sometimes they do. Ignoring them doesn't just risk losing precious time. It risks losing a patient's trust. It risks outcomes that can never be reversed. This story is a powerful reminder that in medicine, vigilance isn't optional. It reminds us that uncertainty requires humility, and it shows that a doctor's ethical responsibility goes far beyond just having good intentions. Medicine isn't just about knowledge in textbooks. It's about paying attention, it's about timing, and it's about having the courage to act before you have absolute certainty. This is why medical ethics matter, and it's why every single warning sign, no matter how small, deserves to be taken seriously. Thank you for watching. If you want to learn more about the real stories and complex truths behind modern medicine, make sure you subscribe to the Truth Clinic.